Hello and welcome back. My name is Benjamin Faust, and we're going to have a great economic discussion today about the American healthcare market, the United States healthcare market. Now, I know you're sitting there and you've been waiting for several weeks, but I am back. You're sitting there with your springtime now, so I'm going to innovate. We're not just doing bowls of cereal now. We are doing deviled eggs and kale. I know you're sitting down eating deviled eggs and kale right now, and you're just eagerly awaiting the knowledge that will be bestowed upon you by me. This is what I do for you. You know, I wake up and I'm like, I can't just stay in bed on a Saturday. I have to do this. It's for you. I sacrifice for you. I want you to know that. Our title for today is The Past, Present, and Future of American Healthcare. We're going to start with how we got here. Before we do that, let's premise something. Something's wrong with the American healthcare system. If you did not know that, it could be because you're not in the United States, and that's acceptable. If you're in the United States and you don't realize there's a problem, it's probably because you're too young to worry about it, or you've just had good insurance your whole life, or you've been living in a box, something like that. If you didn't know, it's not a big deal, but it's a problem. We're spending a lot of our resources on healthcare. We're spending 17% of our national income on healthcare. Now, it's roughly a fifth. It's getting close to a fifth. But other countries similar to us are spending about 10%, and some are spending even less than 10% of their national income on healthcare. So we're a little bit high. And yes, we have a very good healthcare system, but our insurance system may not be the best. And as we're going to talk about a little bit, when your insurance system is off, everything's a little off. So, how did we get here? Okay, first we're going to talk about what is insurance, okay? There's a friend of mine I actually met by doing these videos. His name is Jim. He teaches in Florida, and he's said several times, because I've been saying, I'm going to do a healthcare video, but not yet. But today's the day, by the way. But he's like, when you have car insurance, does it pay to fill up the gas tank? Does it pay for routine maintenance? The answer is no, and that's part of the issue here. Insurance should be financial protection against an unplanned for calamity. That's not what healthcare is in the United States. So keep that in mind as we're going through this discussion. What we call insurance for healthcare is not true insurance. How did we get here, though? How did we get to the point where our insurance is distorted? It started many years ago. The first major event, and there was probably lead up to it, but 1965 is when the United States passed Medicare. Medicare, if you did not know, is, I know in Australia Medicare just means the national healthcare program, but in the United States it means for old or disabled people, or people with kidney problems, severe kidney problems. Anybody, you can be born without kidneys in the US and you're immediately on Medicare. So it's mostly retired people, but it's also some disabled people. And the reason we started this in 1965 is they were worried that healthcare costs were getting too high. So we're going to make a chart here. Let me get some extra. We're going to try some orange today. So orange is going to represent our cost of healthcare. And so people are looking at this and they're saying, there's a lot of cost. It's right there. And we have, there's a gap. Maybe people have incomes of like right here, or they have the means to pay, or they would, politically, we would like to have them pay this, but the costs are that. So what did they do? They actually pushed money into this Medicare program, which was basically like funding, and I think I botched this analogy a bit, but here's what we had. Let's redefine these. This is the healthcare cost. This is maybe the protections we had in place, like people's savings or what they had ability to pay for in cash, and people felt like there was a gap, especially with the old and infirm. They're like, people on disability really cannot afford this when they have this, okay? So there's a gap. So what the government did to fix it is they said, not a problem. We're going to add some buffer to that. We're going to add some insurance to help cover that. So on top of what the resources people had, they're going to have insurance goes on top of it and kind of helps pay for this large expense. But what happened is it caused what we call an income effect, okay? Income effect is, again, is healthcare true insurance? It pays for example, your annual checkup, preventative stuff, routine medications that you're on every day of your life. It pays for things that normal insurance would not pay for. And so when we're thinking about healthcare insurance, I almost want you to take out the word insurance and think of it like a big bank account from which we as individuals are buying healthcare. So if you're thinking about we're buying healthcare with this kind of program, it acts like an insurance program and it's kind of a bank account. It kind of makes our thinking change, and we're not thinking like, how much is it going to cost? We're going to think, is my insurance covering it? And so what happens is we add insurance levels to people's money to help pay for the higher expenses, and what happens is that creates an income effect, which means the costs go up. And that's exactly what happened, and you can see charts. It's just incredible. Like after Medicare was introduced, there was a while the costs stayed low, but it just creeped up, and then it exploded, and then we've done more since. So that was 1965, and then costs went up eventually. You had further reforms, and both parties did this. Most recent two large changes were, I think Nixon did a change or two, but like reform or revised it, maybe expanded Medicaid, which is for the poor. But you had this happening, and then you have, what would happen is there would always be a political response like, well, the costs are too high. Look, again, there's that gap there. So we're going to add, I'll use the wrong color, but we're going to add some more insurance, which is going to drive up the costs. And then we're going to be like, it's too expensive, so we're going to add more insurance, and it's going to raise the cost. So you're building this like ladder of death, okay? So you have insurance that's not insurance. It distorts people's behavior. They can't afford stuff, and so the government just keeps flooding big old dollar signs into the spending market, and it's pushing upward pressure on the costs. Most recent two major ones were, both parties are doing this, like I'm saying, 2003, I believe it was a Republican-controlled Congress, along with George W. Bush, did Part D of Medicare, which basically made it, except for there's a donut hole in there, and I think it may be closed now, but there was, it basically paid for prescriptions for elderly people, which again, caused this sort of thing to happen. And then of course the more famous one was the 2009, I think it was passed, was the ACA, the Obamacare. And again, so you have both parties, it creeps up, and then the expense goes up, and they keep doing kind of the same thing. You've got like I said, it's a ladder. You're climbing up this expense, and expenses are shooting up, and the government's responding by pumping in money. And you're seeing predictable results, such as if you are one of the so-called lucky ones to be on a pure Obamacare plan, then you're going to notice that if you're not getting subsidized, your premium is probably very high. In addition to that, you can't afford to use the doctor because the deductible is also high. So you're actually getting, at some level here, you're getting a result that is poor, and it's not even acting like insurance, it's not even acting like healthcare insurance at all. It's just, if you had a catastrophe, it would kick in, but you're getting very distorted results. And again, and there was the election, and this last election, I didn't see a lot of issues being discussed. I saw a lot of personal banter back and forth, but I believe Hillary's plan was to actually up this again, and Donald Trump is like, we're going to moderate this. Nothing's happening. It's just both parties are pushing it up, and either party is not really fixing it. There's a couple ways, and we're not there yet, but how did we get here? We climbed this ladder, okay? It's not insurance, it's a healthcare thing, it's a creature of healthcare that we're using to buy healthcare services from. It's pushing up our costs because we're adding insurance, and so our costs are going up, and then we keep adding insurance to fix the problem. That's what's going on. Where are we now? I kind of already covered that. We have high costs, and nobody can pay for anything without insurance, and so it becomes and if people do have insurance, they're not controlling their purchases. So the doctor will just order tests. At my particular workplace, we have a choice between a traditional plan and a healthcare savings account joint, it's called consumer driven, and it's still a pretty good plan. The deductible is lower than, I know folks on Obamacare, and their deductible is way higher than mine, but I do that, and I tell the doctor, I'm like, don't just order tests, you got to talk to me, because I pay everything in cash up to my deductible, which I feel kind of in control, and that's good, but I might switch because I'm paying a lot for different things I want or need, and I'm not getting, it's almost better for me to jump on, since I do have access to good insurance at my employer, it's almost better for me to jump on and have them, not true insurance, just pay for more stuff. But, it's kind of where we are, and I really morally think we should have more consumer control in there. So, where are we now? We have high costs. Our quality is good, but it's not, our cost is not driving the quality. Our cost is being driven by this income effect, okay? It's not necessarily, we're so good, our 17% of GDP is buying way healthier outcomes than other countries. Not the case. In fact, really not the case. Like, other countries do better on less than we do. What the future holds. This problem is not insurmountable. I mean, it might seem like that because there's a lot of, healthcare is a very challenging subject because everybody needs it normally, unless you die in an instant. Everybody needs it, and the end result is always the same. You're eventually going to pass away, and most of your expenses happen in the last 6 months. So it's very touchy, and I understand that, but what we're doing is insane, and there's a couple ways we can fix it. What does the future hold? Let's talk about that. We have, yes, I just dropped my markers on the floor, whatever. My house, my choice, right? Okay, so where does the future hold? I have 3 things on the board here. I said less is more is less, or Singapore. I was trying to rhyme more in Singapore, more Singapore, but less is more is less, or Singapore. Less is more, basically, is the idea, and oh, God bless the Republicans, but they're not pushing this really. But what you could do, I threw everything on the floor and then I need my little handy thing. What you could do in theory is you could say, this pumping of money into the system, we're going to roll it back and we're going to chop it. And what that would do is that would chop this down too. It would force this out, because the money all that's happening is we're pumping money in, and it's being soaked up by providers and large companies and small providers too. But doctors, really, it's an information cost. We trust them. If we need a test, we get a test. And if you're on Medicare and you have like Plan F full coverage, outside of that, you don't pay for anything. They order a test, you take it, and the doctor's just going to test you on everything because, I'm not saying doctors are all like that. They might take into consideration, the patient doesn't like tests or something, but honestly, as a patient, I'm like, yeah, test me, test me for everything that's free. Sure, I'll take that. I'll take another, I'll take monitoring of my cholesterol 3 times a year instead of 2, so whatever. But like, if you chop this, less is more, you chop this, it's going to force the price down. This should be the center right, or even the far right way of handling this. It should be chop out insurance. This is very problematic to do, though, and the reason it's not being done by the right in America is because when you're cutting this cost, you're not just cutting, and when I'm saying insurance, you're thinking, oh, my employer plan, or this or that. I've got news for you, you think we don't have national health care. More than 50% of the healthcare dollars in the United States are controlled by these 3 initials, CMS, which stands for the Centers for Medicare and Medicaid Services. If you're from outside the U.S., that means poor people, indigent people, you might not call them that, or senior citizens, the disabled, and there's also some other programs like S-CHIP, which is for children. You've got a couple others, I think, but CMS, which is if you combine it, I believe it's now the largest budget item in the United States. We're spending so much money on it. They control 50% of the healthcare spending. So you're not just going to say, well, Aetna and Blue Cross Blue Shield and Cigna, you are bad, and we're just going to we're going to force you to act like insurance and not act like... No. Because the worst offender is CMS. They are not doing anything to control the costs. So if you're going to do this method to cut things down to lower the prices, you're going to have riots in the street because you're going to be cutting somehow Medicare, Medicaid, S-CHIP. That means children, old people, sick people, poor people. Politically, you want to do that? I don't think so. So that's, a true statesman could say, we need to take some medicine to fix this or we're going to be in trouble. And we are going to be in trouble with our budget if we don't fix this. But that's why when a few weeks ago it failed and people were asking me, what's up with this American Health Care Act? I'm like, well, it's not doing this very much, if at all, because people are like, well, we want to fix the program, but we want to keep all these goodies we have. We want our children covered till 26, and we want no pre-existing conditions and all these things. And I understand, if you have a pre-existing condition, that's very important to you. But I'm saying, if you're actually going to fix it in a, quote, conservative, unquote, way, you're going to have to, actually cut CMS. You're going to have to it would save the government money, but not just to save the government money, but you have got to get out of the market and push. There's another way to do this. We're going to talk about the center left way to do this in a second, but if you're doing the center right way to handle this, you need to push out those dollars, put the costs down. You probably keep some protection because I really admire America. We're a very compassionate country in some ways, and we do have a lot of wealth, and we do try to help people, so you probably keep some level of stuff. But if you push out those dollars, then people have more say of what they're doing. You get less CMS involvement. I mean, they set prices. There's this magical building, and they sit there and decide prices, and there's not really, we don't really know how they do it. And it's not really to control costs. They're not acting like that. They just, certain things are this way, and they set and then all the insurance companies copy what they do because they have such a large market share. So if they raise the doctor fee for a 15-minute visit by $10, everybody else will too. It's kind of how it works. So that's what you could do. Less is more means you cut out this support system. By cutting it out, you reverse the income effect, and you kind of push down those costs by allowing less insurance dollars to be purchasing healthcare and more people dollars, like your consumer dollars. My feeling on America is America does not really want that because they don't act like it. They don't want to pay out of pocket for stuff. But if we all did it, it would, sure as heck fire, it would work. We would have less costs, okay? Less is more. We just covered that. Now we're going to cover more is less. What you need to do in that. This is the center left, or the more Democratic Party way to handle this. What you do is you say, yeah, I did throw stuff all over the floor, didn't I? Yeah. There's 2 ways around it. I'm going to pay for that for the rest of this video. What you do is you say, this buildup is ridiculous. All this money we're putting in. What we're going to do to this money, there's a great dollar sign, huh? So all we're going to do is, instead of just letting it go up, and then this goes up, instead of doing that, what we're going to do is we're going to limit, and we're going to cap the dollars at this amount. And what that does is that forces this down. Okay, this is very common, and you'll hear about it if you're ever talked to somebody who supports this kind of thing. It used to be called universal health care, but just like anything that sounds negative to people, it changes names frequently. And so what you had is, it was universal health care, and then now they're calling it single payer. But single payer actually economically is a very good description, because what you're doing is, instead of just throwing money and kind of having some people in a big building in Washington, D.C. set prices, what you're doing is you're deliberately cutting the cost out. You're saying, we're going to pay for, in fact, we're going to actually pay for more. In fact, if you actually did this the right way, you would take over the entire healthcare industry. NHS in England, it's very hard. You can practice outside of NHS, but you have to do so many hours for NHS, which is their national healthcare system, before you can work outside of it. So there's if you force all the providers into one big box, you have something going on called a monopsony. You've heard of a monopoly? A monopoly is one seller. A monopsony is one buyer. So what you do is you say, we in the U.S. government, CMS is now going to be the agent for everybody to buy healthcare. And we're going to basically force all the providers to pony into one pool, and we're going to pay you. But what they do to control the costs, and this is why you do this, when you're the only one purchasing it, you really can push down costs. You can say, well, what's that new, Harvoni is that new hepatitis C drug that has a 96% cure rate, costs $100,000 in the US. What you can say is, that's nice. You have a drug that cures hep C, and we've got a lot of baby boomers who are a little bit wild in their younger years, or maybe they're not wild, they just got a bad blood transfusion. Let me tell you what, we're going to buy your drug, but we're not paying $100,000. We're going to pay $2,000 per course, and you're just going to have to be the toughest drug company there ever was and accept it. You can do that kind of stuff. You can push the cost down. This is, I told you some of the negatives of the center-right way to handle this, that people would lose coverage, they'd have less government support, and they'd be riding in the streets. Politically, it's very difficult. This one's bad because you're going to get a creep of lower quality. You're going to achieve less innovation in your practices in medicine and your drugs, and you're going to get wait times instead of, you're not going to pay with dollars as much as you're going to pay with your bodies. And so if you have something routine, like going to the doctor, you're not going to have much of a wait time because too many people would complain about that. But if you have a weird kind of cancer, they might put you on a wait list, or you might have to wait to get treatment in order to basically let you take care of yourself and die before you get treatment. I don't know how malicious it is, but it does happen. You hear stories out of Canada and the US. I have a friend in Canada who, his dad was going to die from the liver cancer, but he could prolong his life with chemo. He was on a wait list, so he found a loophole, and he wasn't going to get chemo, but he's like, figured out the schedule. He went online, Googled the drug, and he's like, okay, Dad, what we're going to do is we're going to go to the emergency room every 2 weeks or something, and they're going to have to treat you because, I guess in Canada, if you go in for something, they'll just have to give you a round of chemo. So basically, he got around it by doing that. But that's the kind of stuff you get with this. You get a distortion because the government is lowering the cost by buying everything, but the government is not going to ensure you get what you want. There's a drug, not a drug, it's a vaccine. There's two of them. One is called Gardasil, one is called Cervarix. They both have different things that are good and bad about them. In the US, and it's for HPV, so it's for sexually transmitted diseases, and it prevents cancer and prevents genital warts. And so in the US, you can get either one you want, but they do different strains. There's 100 strains of HPV, and like Cervarix does like couple, and Gardasil does more, but it's, they have different qualities that are good and bad about each one. In the US, you kind of decide, I want this one, I want that one. If you go to England, Cervarix won the bid, so you don't get Gardasil, and Gardasil is the one that covers the warts, and so it's possibly that, some HPV causes warts, some of it causes potential cancer. So if you go to England, you don't get a choice of, do you want Gardasil or Cervarix? You might have an uncomfortable choice there. That's the kind of things you get. You might not get the extended release of the drug because they're only going to buy the one. You may not get Nexium because they're just going to make you take omeprazole, the older form of a similar drug. You get kind of stuff where the government makes that decision rather than you. So it's not happy either. And so you can, but it does work to cut the cost anyway, and you can still have a decent healthcare system, but it's not as good as what we have right now. What we have right now is bad, but I'm not convinced that would be better, except on our budget, because our budget's out of control. Let me say a word about the budget. People, I don't think they realize our budget is out of control, and it's being driven by healthcare costs. A little bit Social Security, but the real driver right now is healthcare costs, and it just keeps shooting up. And we're just not equipped to take that on forever. And it might be 20, 30 years, but we're going to have a budget crisis. You can watch a previous video of mine about what happens when countries are in too much debt to see what will happen in the U.S. if we don't change our ways. But it's got to be done. And either of these ways, the less is more or more is less, either one is effective for the budget problem. It's just, how do you want to have pain? Do you want to have pain in this way or pain in that way? We've got to do something, because what we're doing right now is failing atrociously. Now, less is more is less, or Singapore. Singapore spends about, and they are developed, they are one of the 4 Asian tigers, so we consider them an advanced economy at this point. They spend about 5 to 6% of their GDP on healthcare, way less than like France, Germany, US, way less. Less than a third of what we do, and less than half of what they do in France and Germany. But they have like what they do is they use both methods. They say less is more because they let consumers control the dollars, but they say more is less because they kind of force everybody to put money in a mandatory file, like a mandatory health savings account, and then they force people to use that to buy. And so you have that working, but would it work in the US? I don't know. Singapore has East Asian genetics and lifestyle habits, which are typically healthier than the Western habits, and they also have a government that is, I believe it's the same leader for a long time, and he's very strong, so he can implement something that's a little controversial like that. So less is more is less. There might be some hybrid in there where you can work it out and solve the budget problem and keep some freedoms with your healthcare purchases, but do we really want to do what Singapore does? For cost, it might be very effective, but it may not be acceptable to the American mindset. So, as you can see, healthcare is not and you have to keep, when you're talking about economics, especially with something painful like healthcare, you've got to keep a sense of humor, because this is depressing. It's like, well, it's bad now, and if we do this way to fix it, it's bad, and if we do that way to fix it, it's bad, and if we were Singapore, it would be good, but we don't have a dictator, and I don't know if he's a dictator, he's just been there for, I think he probably is on some level, but he's done a decent job with healthcare anyway. But it's kind of like, but that's economics though. You have to make choices. You have to choose something, and you can't just choose. We can choose status quo. We're gonna have budget problems in the future if we do that. That's why you got to keep a sense of humor talking about these sort of subjects. And also, in addition to that, when you're looking for ultimate answers in your life, you should not look to the past, present, or future of any country's healthcare system. You need to look up for the answers. If you enjoyed this video, please give me a follow or a friend request. I'm on Facebook, facebook.com/Benjamin Faust, all one word. I am on YouTube. If you're seeing this on YouTube, make sure you like and subscribe. Share the video if you enjoyed it. And I'll be back soon for another adventure. Take care.